Most people would agree that having a baby is life-changing, and deciding how you should have your baby is a big decision. And that's why our sponsor from Southwest Women's Care wants you to know you have some choices. So joining us now is Dr. Jamal Murad, and he is partner at Southwest Women's Care and the Arizona Institute of Minimally Invasive Surgery. And let's talk and please introduce yourself.
I'm Laura Kimbrough, also from Southwest Women's Care.
So nice to meet you, Laura.
Thank you.
Tell us what you guys do. Who does what?
Well, we're partners in an obstetrics and gynecology office that practices here in the Valley, in Mesa and Phoenix. And we take care of women of all ages and with all sorts of problems. You
guys must have such a rewarding and exciting career. Seriously. I mean, you're dealing with babies, you're dealing with the preciousness of life, you're dealing with moms who are, you know, they're nervous, and, you know, many first-time moms, and then you have those complications and those last-minute births and all those things. I know that there's so many more choices nowadays. I mean, I gave birth at 45, which, well, that was 9 years ago, and even then, you know, times keep changing. Technology gets better, medications get better. What is the best that you would possibly wish to recommend to people about the way to have a baby, you know, the natural childbirth, that kind of thing?
You know, certainly, I think childbirth is something that hasn't changed in, you know, over the, you know, over our lifetime,
right,
over our, you know, experiences. But the technology that we have to allow women to have that birthing experience that's safe in an environment that's positive and inviting has changed quite a bit, and the choices that we have reflect that.
Is there a preferred? Oh, we've got a little microphone problem, but is there, you guys, is there a preferred method? I mean, to me, if I were to do it all over again, I would go do it. I would go do this, you know. I would be braver. I would maybe, you know, not do an epidural, and you know, and you guys really recommend doing what works best for you and what works best for your health.
As a husband, as a father, as an obstetrician, I had Laura, my partner, deliver all my babies, and the choices that we make, I think, reflect who we are and what we do. And having a baby is got to be what you're comfortable with.
Yeah.
And natural childbirth is a definitive great option for all women, but there are some limitations and restrictions that we all have to be aware of.
To me, the safe factor would be to maybe have the natural childbirth and have it in a really nice, plush, cushy hospital setting.
The combination of both.
The combination,
worlds.
am I right? I mean, it really,
nice,
because you've got the professionals there, because what are the chances that something could go wrong? Not high, but if you're the one, and
absolutely. You know, I talk to my patients about statistics all the time, and statistics are really important, I think, if you are in an academic setting, but if it's about you and what happens to you during your childbirth experience, it's 100%, no matter how little that statistic is.
Yes,
we have a few numbers here that, you know, demonstrate the safety of natural childbirth, both in, I guess, in a home environment or in a hospital environment. We talk about the you know, maternal mortality and morbidity rate that are studied all over the world. We have
what are we looking
on
here?
the screen.
We have yes. What are we seeing?
We have the maternal mortality rate, which is approximately how many deaths per 100 births take place. In comparison, the developed world, the United States, Arizona, and the best in the world, which has been Ireland.
Really?
We're closely...
Let's go.
Yeah, we're approaching that number, but we're not quite there yet. And I think that reflects what we have to offer as far as the best possible technology for a natural process such as childbirth.
You guys have it all. Let's admit it. You do.
We have the best. We have the best job in the world.
You have everything. Yeah. I mean, you've got, you know, once you help a mother to be carefully determine what's best, then you can say, oh, we've got the, you know, birthing pool, and I mean, whatever. I mean, do you guys have all of those cool? Do you?
We have a bath and we have a tub in the hospital.
Nice.
I mean, really, there are all the options. A lot of people want different things, and whatever they want, we try to provide for them in a safe environment.
What do you encourage people to do? To research the doctors, to research what their choices and their options are?
Yeah, I think, you know, there are a lot of choices to be made, and knowing what your choices are and who your obstetrician is, where your facility is going to be, is very important. There are differences, tremendous differences between providers and healthcare facilities, and knowing more about those choices will allow you to make better decisions, I think, along with your healthcare provider.
Don't you guys have, like, 24-hour staff, and
We do.
I mean,
We have
that's everything. When you're in labor at 2 a.m. and
we have created a special program here in Arizona that has, I think, taken a special dimension in obstetrics, and we started a hospitalist program for OB/GYN that allows one of our partners to be in-house 24 hours a day, 7 days a week, 365 days a year, so that we can be there for you at the moment that special event takes place without any other responsibilities.
thank you guys so much. I'll tell
Thank
you, they know everything about birth and babies. Contact information for Southwest Women's Care is on your screen. Southwest Women's Care. You can check it out, and it is in Phoenix, and the number is 480-785-2100, and that is in Mesa. Thank you so much, you guys.